Ladies and gentlemen, coming to you now straight from the headquarters of the Top Cat's Pride, is presented the unusual but factual and oftentimes controversial Wild News, featuring various international reports that will inform you and keep you in the know while you're on the go. And now, your Wild News reporter, Q. Pate. You know, since 2001, since September 11th, around September 11th, 2001, I've noticed that there has been a huge reemergence and a huge surgence of infectious diseases being reported on by the mainstream media, the international mainstream media. And if you've noticed like I have, then I'm sure you've thought about from time to time, what in the world is going on? Why has there been so many reports, and why is there so many different reports having to do with all these infectious diseases? Well, I decided to do a little research. And so I'm here now to share this with the Top Cat's Pride, and well, also whoever else is interested in this intelligence, in what I found.
Out front now, the trauma surgeon, Dr. Mark DeMoya. He treated a woman infected with a flesh-eating bacteria, was able to save her life. Dr. DeMoya, thank you for being with us. I mean, a tragic story and horrific, and people can get these in any kind of a cut. The man from Mississippi, Nick DeVernay, got sick and died in just 4 days. How worried should people be about this?
Oh, Aaron, absolutely. People should be very worried about these sorts of infections. Once they take hold, they can really take off and really consume the body, in essence, in terms of its resources. So
the cases Miguel was talking about, these were people who were fishing, they were people who were swimming. But then there was someone who said he just touched some shrimp, hadn't actually been in the water. Can you be infected by the flesh-eating bacteria if you're not in the water?
The flesh-eating bacteria is kind of a broad category. The type of bacteria that actually infected those people that you're talking about was specifically the type of bacteria that could actually go through can go through a cut. So you have to really have some sort of portal of entry, you know, whether it's a cut on your hands from fishing or a scrape on your leg that you may even think that is not so bad.
So it could be something you don't even notice as kind of a break on your skin. But what about, so is it possible that I don't have a break on my skin at all, that people are assuming you can get it on your skin, it's sitting there?
Right. So these, many of these other drugs, not the ones that are associated with the water, but the ones that are found in the community, I mean, they're found everywhere. The bacteria live on our skin, the bacteria live in the community. And if they have the right circumstances, the right environment to set up shop, in essence, especially in patients that have some sort of immune system compromise. So patients that are have liver failure, that have some sort of immune dysfunction, that are on medications that suppress the immune system.
Welcome to the Wild Report. My name is Otis Q. Pate. I prefer if you just call me Q, because many people don't seem to be able to put the T in Otis. So I've kind of grown accustomed to just being called my middle name. That's what my friends call me. And I want to tell you about many of these diseases right now that I've noticed surge in the mainstream media since 2001. In particular, at least that's what I've noticed. Diseases like anthrax, Ebola, monkeypox, foot and mouth disease, mad cow disease, swine flu, avian bird flu, mad deer disease, SARS, which stands for severe acute respiratory syndrome, West Nile, Lyme disease, chronic wasting disease, MERS, which is an acronym MERS, which stands for Middle East Respiratory Syndrome, as well as mad elk disease, H1N1, H7N9, which has to do, both of those have to do with some type of bird flu type of disease, dis-ease, and it spreads from mammal to mammal and person to person. Another one, sleeping disease, fungal meningitis, zombie disease, which is also called necrosis. The sleeping disease that I mentioned has actually nothing to do with sleeping. The sleeping disease is caused by the parasite, and these are scientific words, which is really another language. It's a whole new language all in itself. So please excuse me in the pronunciation, but all the words that I'm mentioning now will be under the description area for this video. But sleeping disease is caused by the parasite Trypanosoma brucei. And I'm not going to spell that because it's very long and I would like just to continue. And it's transmitted by the tsetse fly. And I'll spell that because it's spelled T-S-E-T-S-E. This fly is also known as the tick-tick fly. That's what the sleeping disease is caused by. And if you was to see the pictures of those who get the sleeping disease, it's atrocious what this fly is able to do. However, I'm going to focus right now on the skin-eating bacteria, because the skin-eating bacteria has been widely reported on by the mainstream media recently. As of this video, I would say up until about 5 days ago, the point in which I start gathering this information for myself and to share with anyone, up until that particular time frame, it was like almost, I would say almost every day, if not every day, for the last couple of weeks before that, that this story has been in print, has been on news websites, has been on international corporate media news programs like, you know, BBC, CNN, Al Jazeera, Russia Today, MSNBC, etc. Skin-eating bacteria. Well, this is also known as the flesh-eating bacteria. And media reports have popularized the term of flesh-eating bacteria to a type of very rare but serious bacterial infection known as necrotizing fasciitis. And again, the words will be under the description box of this video. Necrotizing fasciitis is an infection that starts in the tissues just below the skin and spreads along the flat layers of tissue known as the fascia, spelled F-A-S-C-I-A, that separate different layers of soft tissue such as muscle and fat. This dangerous infection is most common in the arms, legs, and abdominal wall, and is fatal in 30 to 40% of cases. And that's actually a lot better than I thought, because I thought that, you know, it was about 75% fatal. However, according to this research, which comes from medicinenet.com, according to this research, 60% of the people that get this disease, 60% of them survive it. And to me, that's good news. But we need to alleviate this disease, the skin-eating disease, this flesh-eating bacterial disease. Although necrotizing fasciitis may be caused by an infection with one or more than one bacterium, in most cases, the term flesh-eating bacteria has been applied to describe infections caused by bacterium known as, another one of these words, so please forgive my mispronunciation, streptococcal pyrogenic. The term flesh-eating has been used because the bacterial infection produces toxins that destroy tissues such as muscle, skin, and fat. Streptococcus pyogenes is a member of the group of streptococci, a group of bacteria that are commonly responsible for mild cases of sore throat, pharyngitis for example, not laryngitis, pharyngitis, here spelled with a PH in the beginning, and skin infections, as well as rare severe illnesses such as toxic shock syndrome and necrotizing fasciitis. Most infections with group A and streptococci result in mild illness and may not even produce symptoms. Sometimes, other bacteria or even a combination of different bacteria may produce necrotizing fasciitis. A case was reported in 2012 of a young woman who suffered a zip lining accident on a river in West Georgia in the United States. Zip lining is when there is a cable that goes from one end of an area to another end of an area. Maybe it might be 100 yards long or 50 yards long or 200 yards long or meters or what have you. And the person that's on the zip lining contraption, they hold onto a pulley, and then they slide down this cable. They slide down the cable from one end to the other. That is called zip lining. This woman contracted an infection with the bacteria Aeromonas hydrophila, which produced a necrotizing infection that resulted in the loss of a leg and part of her abdomen. So I guess what happened when this woman was using this zip lining technique, form of transportation or what have you, she was probably going across a body of water, and when she did that, she probably slipped and fell in, or perhaps the zip line was not tight enough, taut enough, so she might have went into water or what have you, and she may have had some injuries on her body, some open sores, some open wounds on her body, and this bacteria that causes the infection for the skin eating disease, the flesh eating bacterial infection, or what have you. There's many different names for it. This is probably how she contracted it. Nevertheless, the symptoms of necrotizing fasciitis. The symptoms, now these are the symptoms for you, of necrotizing fasciitis include redness, swelling, and pain in the affected area. Blisters may be seen in the involved area of skin. One may also have fever, nausea, vomiting, and other flu-like symptoms, which are very, very common when one contracts this infection. Another characteristic of necrotizing fasciitis is the symptoms develop very rapidly, usually within 24 hours after a wound in the skin has allowed the bacteria to invade the tissues beneath the skin. The pain is described as being more severe than what would be expected from the appearance of the wound. So the pain is off the charts. Recent wounds, including surgical incisions, like if you get stitches after a surgical procedure, this is considered a wound by the medical field. Recent wounds and recent viral infections that cause a rash, such as chickenpox, also confer an increased risk. One has to be very careful when you go into water if you have open wounds. Necrotizing fasciitis is treated with antibiotics when you go to the hospital. And early treatment in the hospital is paramount. So if you think that you have any of the symptoms that were aforementioned, and when in doubt, go to the hospital. If you have any of those symptoms, it is best that you go to the hospital or go see your doctor or call over a doctor if you can't leave your home or wherever you may be, because this disease spreads extremely quickly. Hospitalization, usually with treatment, is in the intensive care unit, ICU. And surgery to remove infected fluids and tissue may be necessary, along with medications to treat shock and potential complications. And just to cite this particular article on the flesh-eating bacteria infection, or the skin-eating bacteria, also called necrotizing fasciitis, is from Robert A. Schwartz. I'll have his name in the description box. Robert A. Schwartz. From an article he wrote called Dermatologic Manifestations of Necrotizing Fasciitis in June on the 9th during the year 2011. However, I have to say at this time, there was something that I realized and something that I compiled in my notes having to do with this horrible disease. The thing that I noticed that was, very odd, because it was so long ago, is that a man by the name of Joseph Jones in 1871, with his original description of hospital gangrene, was like the first report having to do with necrotizing fasciitis. The man's name was Joseph Jones. And this was following many experiences he had during the U.S. Civil War. This is when it first came up, the symptoms of this disease. This is when it was first apparent, or this is when it was first realized. Now, onto the bit of the second report about necrotizing fasciitis, the skin-eating bacteria. And I'm going to provide solutions as well. But necrotizing fasciitis, also known as NF, commonly known as the flesh-eating disease, flesh-eating bacteria, or flesh-eating bacteria syndrome, is a rare infection of the deeper layers of skin and subcutaneous tissues. The most frequent or consistent of necrotizing fasciitis was described in 1952 as necrosis of the subcutaneous tissue and fascia by Dr. B. Wilson in 1952. This disease was basically given its name to identify it in the way that we know it today, you know, from the symptoms and all of these other things that points directly to a patient, to a person having this infectious disease. Necrotizing fasciitis progresses rapidly, having greater risk of developing in the immunocompromised system due to conditions such as diabetes or cancer. So those with diabetes or cancer have to be even more careful, because when one has diabetes or cancer, your immune system is not up to par. It is a severe disease of sudden onset and is usually treated immediately with surgical debridement and high doses of intravenous antibiotics, with delay in surgical treatment being associated with higher mortality. Many types of bacteria can cause necrotizing fasciitis, and the majority of cases of necrotizing fasciitis are polymicrobial, with 25 to 45% of cases being type 2. Such infections are more likely to be in or occur in people with compromised immune systems secondary to chronic disease. And since 2001, according to this report, a particularly difficult to treat form of monomicrobial necrotizing fasciitis has been observed with increasing frequency. This is what I was talking about earlier, that I had noticed since 2001, since September 11th, what I noticed. Well, this article also says since as early as 2001, a particularly difficult to treat form of monomicrobial necrotizing fasciitis has been observed with increasing frequency, caused by methicillin-resistant Staphylococcus or Staphylococcus aureus, in an acronym form that's known as MRSA. The majority of infections are caused by organisms that normally reside on the individual's skin. These skin flora exist as commensals, and infections reflect their anatomical distribution. Sources of MRSA may include eating undercooked, contaminated meat. These are the sources of MRSA. Working at a municipal wastewater treatment plant, exposure to secondary waste water spray irrigation, consuming raw products produced from farm fields, fertilized using human sewage, sludge, or septage. And I didn't even know there was a likelihood of that occurring. That is just plain disgusting and criminal. Also, people contract this disease, oddly enough, in hospital settings from people with weakened immune systems, or sharing using dirty needles, whether that's for insulin shots. Some people do that if they can't afford needles or may not have a needle. And of course, there are those who are hooked on cocaine or heroin that also may share needles. The risk of infection during regional anesthesia is considered to be very low, though it has been reported. So again, here's signs and symptoms. Over 70% of cases are recorded in people with at least one of the following clinical situations: immunosuppression, diabetes, alcoholism, drug abuse, smoking, malignancies, and chronic systematic disease. For reasons that are unclear, it is occasionally occurs in people with an apparently normal general condition. And that's very odd. Occasionally it does happen with people with just normal conditions, where the immunity system is up to par, working fine, and this, that, and the other. And I think that has to do with what we were talking about earlier, with the articles talking about earlier, with open wounds, whether that's stitches that are still, the wound is still able to become infected if you're in an area that houses this, that contains this bacteria. That's how it enters the body. Or in water, you know, through the mouth. Even if you're healthy and your immune system, you know, is taxed heavily by this disease. The infection begins locally at a site of trauma, which may be severe, such as the result of surgery, minor or even non-apparent. People usually complain of intense pain that may be excessive, given the external appearance of the skin. People initially have signs of inflammation, fever, and tachycardia. Again, I'll have these words in the description box. And with progression of the disease, often within hours, tissue becomes progressively swollen and skin becomes discolored and develops blisters. Cryptococcal may be present, and there may be a discharge of fluid said to resemble dishwater. Diarrhea and vomiting are also common symptoms. In the early stages, signs of inflammation may not be apparent if the bacteria are deep within the tissue. If they are not deep, signs of inflammation, such as redness, swelling, or hot skin, develop very quickly. Skin color may progress to violet, and blisters may form with subsequent necrosis, death of the subcutaneous tissue. Flesh-eating bacteria is a misnomer, as in truth, the bacteria does not eat the tissue. They destroy the tissue that makes up the skin and muscles by releasing toxins. Something that I also found in my research is that the famous US stand-up comedian Don Rickles revealed publicly on May 2nd, 2014, that he had contracted the flesh-eating disease in his right leg. I think he's in his 80s or so. He was treated at a hospital, which came out successfully, but Mr. Don Rickles now has to walk with a cane as a result of contracting necrotizing fasciitis. This report, my notes for this particular report came from Wikipedia, and there's 38 references that are provided for that particular information that I gathered. The last one, the first one was from medicinenet.com. For those of you who would like to go to the Wikipedia page to read this yourselves, to check the references and stuff like that, go to wikipedia.org and put into the search engine skin-eating disease, skin-eating bacteria, and stuff like that, necrotizing fasciitis, and you'll get those 38 references that I looked through that are very reputable. I love the article, and I was glad it was provided for my research. For those who are concerned, or for those who would like to join others who are trying to get this disease alleviated, a website that you can go to is www.nnff.org. This website was founded by two women, two survivors of this horrible disease. And these two women founded the website in 1997. So it's been around for quite some time. And these women are both from the United States of America.
Welcome back. It's a scary disease with a scary name, Vibrio Vulnificus. Although it's commonly known as the flesh-eating bacteria disease, it can be deadly. Last week, a 38-year-old Ocean Springs man died just 4 days after contracting it. But you can survive it if you take the right action. Tonight, Doug Walker talks with a doctor who's an expert on treating Vibrio. We want to warn you, though, some of the pictures you're about to see are pretty graphic.
Dr. David Spencer Sr. has seen a lot of Vibrio vulnificus over the years. There's a reason for that.
It is a saltwater surviving bacteria, so salt water does not damage the bacteria. It actually lives in salt water. So we see it in all of our estuaries.
Certain people are more at risk, those with liver problems and other factors.
We also see it in patients who have immunosuppressive medications or are immunosuppressed for other reasons.
But perfectly healthy people are not entirely safe, especially if you enter the water with an open wound or get injured in the water.
With a deep puncture wound within the saltwater environment, there's probably a higher risk that someone who is not immunosuppressed may have a higher risk of picking this up.
Vibrio works fast. That's why you need to seek treatment just as fast.
This disease process can become nearly fulminant within 12 hours to 72 hours after exposure.
If you don't act fast, it can be deadly.
Once it gets in the bloodstream, the mortality is at least 50%, if not greater.
Right now, the risk is greater.
We do see a spike in some of these infections during the summertime because, first of all, the water's warmer. And second of all, there are more people that are involved in water sports and working in the water during that time.
So, how can you protect yourself?
The best choice is, if you have an open wound, is not to participate in water sports within the marine environment.
Some more advice: have fun, but be careful. In Ocean Springs, Doug Walker, WLOX News.
Good advice, Doug. Thank you. Again, medical professionals stress that if you start feeling bad and running a fever shortly after exposure to salt water, get to a doctor or the emergency room immediately. Treatment includes receiving heavy doses of antibiotics and fluids. There is good news as well. Despite the recent cases on the coast, it's still relatively rare, with only 16 cases reported in the state in 2012.
And now some solutions for you for this flesh-eating bacteria disease. I have to state just for the record that this is not medical advice for anyone. You can do what you want to do. What I should say and what I will say is, when in doubt, if there's any information or if you may think you might have it or whatever, seek medical advice from a licensed medical doctor and or institution. Number one, something that I would think would be very helpful, and overall this is about prevention, is to keep your immunity system healthy. Keep your immunity system up to par. And Find out what compromises your immunity system and do your best to avoid them. And if your immunity system is or already has been facing serious challenges, find out what you can do today to rejuvenate and strengthen your immunity system. Number 2, avoid eating undercooked or contaminated meats. Number 3, if you work at a municipal waste and treatment plant, be sure to protect yourself by fully obtaining the information required for you to do so. Number 4, do not consume raw products, produce from farm fields fertilized by human sewage, sludge, or septage. Number 5, refrain from using or sharing dirty hypodermic needles. Number 6, make it a point not to swim or wade in ponds, lakes, rivers, or the ocean when you have a cut or an open wound. As well, if you can avoid swallowing any of the water from these locations, that would be recommended. As it has been also widely reported in print, online, by radio news services, and TV news broadcasts, that this bacteria can and does live sometimes in salt water. And of course, you know, if it can live in salt water, it lives in fresh water, quote unquote, fresh water as well. Number 7, avert also from being in the aforementioned waters if you have unhealed surgical wounds, or if you have a wound or surgical incisions or a cut or a rash. A rash on a person's skin is often cracked, and in those cracks is where the bacterial infection can penetrate your skin and begin to cause you a tremendous amount of trouble. And please, I must mention, keep in mind that once this is contracted, it spreads very, very, very quickly. So when in doubt, go to your doctor, to the emergency room for a checkup. And let the doctors know. I would suggest, what I would do is I would let the doctors know that it might be a possibility. Could they check this out? Because I found in the research that many of the doctors on different parts of the planet didn't understand that disease, didn't comprehend the symptoms, or they misdiagnosed the symptoms. So by the time the doctors found out what it was that this person had, sometimes it's been too late and the patient died. Sometimes it's been too late to where the person had to get horrible surgical procedures done to them, amputations, all type of things. Number 8, always keep in mind, as I just mentioned, but it can't be mentioned enough, early treatment at a hospital is critical when you've contracted this disease. And what that means is within 24 hours, you need to be at a hospital or a doctor should have looked at you during the time that you have the symptoms that have been described. And solution number 9, but certainly not least, is to pay attention to your body, which will alert you to its dis-ease. Dis-ease. Be in tune with your body and don't doubt the possibility that perhaps you may have something a lot more serious than a fever or what have you. You know, in reference to those symptoms that I gave you earlier for this disease. Pay attention to your body. Your body speaks to you. And don't be overconfident or too proud or what have you in order to go to the doctor. And if you can't afford going to the doctor, still go to the doctor and see if you can make some type of installment payment deal with the doctor or the doctor's office or the hospital or what have you. And stick to that agreement. If it's $10 a month until it's paid, or $25 or $45 or $55, $100, whatever it may be, stick to the plan. So that you in the future may use this doctor again if something else comes up for you or your child or whomever that you might bring there. Establishing great credit is always tantamount. So those are 9 solutions that I've provided. Well, I hope that information was helpful to you. And I don't really know what to think about all of these reports coming out concerning this disease or all those other diseases that I mentioned at the beginning of this video, but something is going on. I know many might say it's prophecy or whatever. I don't know about that. But I'm not discounting that. I'm just saying I don't know about that. Perhaps it is. Nevertheless, prophecy or not, I would still like to remain healthy, and I would like for you to remain healthy, and I would like for you and yours, your friends and family, to be healthy. So this is why I'm doing this video, and also to get your opinions, if I may, in reference to this disease or any other diseases that you have discovered, any information that you can provide that's helpful concerning this topic, because other people around the planet may be able to be helped by information that you leave, the knowledge that you leave in the comment section. And, you know, I'll just say in conclusion, if there are those out there around the world creating these diseases and releasing them to the public, and my research does not come up negative in this regard. However, it's not 100% sure, because I in fact have not seen it or experienced it with my own eyes while it was being created, while it was being planted. If there are those around the planet, scientists that are using their time to do this for whatever reason, I would publicly like to say, shame on you. And I would publicly like to ask you to stop right now. Because there are consequences to be paid, regardless of whether you are afraid of those or what have you. There's consequences to be paid, and you can best believe it is time for those who have been doing such sinister things to be punished. Well, this has been the Wild Report with Otis Q. Pate. I look forward to seeing you next time here on the channel. Thank you for joining me, And would you please share this with friends and family who you think should know a bit more detail about this doggone skin-eating disease. I appreciate it. Take care.